Breast cancer is often perceived as a woman's disease, but for one man, that misconception nearly cost him his life. In Abuja, a male breast cancer survivor is sharing his story to raise awareness about early detection and the need for stronger health support for patients across Nigeria. Habeebat Ajayi reports.
Health experts and advocates converged in Abuja to explore new strategies for improving cancer care and patient support systems. Among the participants was Mr. Jacob Omonade, a 49-year-old breast cancer survivor whose personal journey has sparked fresh conversations about the disease often misunderstood. Jacob's experience underscores a rare but serious reality. Medical experts say male breast cancer accounts for less than 2% of global cases, but is often detected late due to stigma and poor awareness.
I have done 6 cycles of chemotherapy, and I have had a semi-bilateral mastectomy and a couple of other tests still going on. Presently, right now, I was told after my last CT scan that the cancer has spread to my lungs and my liver. So I have to go back to systemic treatment again, which is the chemotherapy.
Cancer survivors like Gloria Chinyere emphasize that financial support remains vital as many patients abandon treatment due to high costs.
I was diagnosed in 2017. I've done a mastectomy. I've done several surgeries because I have a recurring cancer that keeps coming back. So I've done several surgeries. I've done radiotherapy, and now I'm on long-term treatment. I had to recommence chemo because the cancer spread. It has really impacted my life in so many ways, both negatively and positively. Positively, I've become an advocate for the disease, speaking up for myself and other people, and trying to give hope to people like me and those that will be diagnosed later.
Dr. Yakubu Agada, the Director of Standards and Quality at the National Health Insurance Authority, explained that while the agency currently supports surgeries and some chemotherapy treatments, plans are underway to expand coverage through a catastrophe health fund for severe diseases, including cancer.
There are the ones that we cover fully, which is a 90%, patient pays only 10%. There's another pathway where, because of the cost, we cover 50% of the cost of medicines, where we are able to have MOUs with the drug companies, the pharmaceutical companies. We are also able to cover 50 by the pharma companies, and then another 30 by the health insurance system.
Usman Aliyu, the Director General of the Nigerian Cancer Research and Treatment Agency, NICRAT, reaffirmed government's commitment to improving cancer detection and care nationwide.
National Health Insurance Scheme and the Institute under the Federal Ministry at the supervision of the Coordinating Minister for Health and Social Welfare has created what we call a catastrophic health fund. And in this catastrophic health fund, cancer is actually one of the 3 non-communicable diseases that are going to be covered. So at least we have multiple channels through which cancer patients are going to be helped.
The Medicaid Cancer Foundation announced the disbursement of 100 million to over 60 cancer patients under its Patient Access to Care program to help ease the financial burden of treatment.
A woman diagnosed with stage 2 cancer in breast cancer in Nigeria today has a good chance of survival. Most of our patients are diagnosed in stage 3 and 4. And so the survival rate for breast cancer is about 25%, a 5-year survival rate. But if you go to high-income countries, UK, US, Australia, and so on, their survival rate is in the region of 90% after 5 years.
As awareness spreads and survivors like Jacob share their experiences, experts hope more Nigerians, both men and women, will embrace early screening and access life-saving treatment without fear or delay. Habeebat Ajayi, Trust TV News, Abuja.